Body sends signals when something's seriously wrong. Recognizing them can mean the difference between life and tragedy. Today, we're going to talk about 7 physical symptoms that should never be ignored under any circumstance. These are the red flags that medical experts say require immediate hospital care. No waiting, no hesitation. This isn't about scaring you. It's about protecting you. Many older adults wait too long to seek help because they assume it's nothing or they simply don't want to bother anyone. But in many cases, early action can stop a minor problem from becoming a major crisis. And more importantly, knowing what to look for puts you back in control of your health. In this video, you'll learn the 7 warning signs in your body that doctors say you must never overlook. These aren't vague symptoms, they're very specific, very real, and in many cases, time-sensitive. Stay with us until the end, because one of these signs might just save your life or the life of someone you love. Now let's get started. Sign 1, slurred speech or facial drooping. There's a specific set of symptoms that doctors and nurses are trained to recognize instantly, and they point to a medical emergency that cannot wait. Stroke. If you suddenly have difficulty speaking, find that your words come out garbled or slurred, or notice that one side of your face isn't moving like the other. You need to go to the hospital immediately. The same applies if you can't lift one arm, or if it drifts downward when you try. These aren't signs to rest off. They're signs that your brain may be in serious trouble. A neurologist once said, "Every minute a stroke goes untreated, you lose nearly 2 million brain cells." Time isn't just money, it's memory, speech, movement, and life itself. That's a hard fact, and one that most people don't fully understand. In seniors, strokes can happen even without warning. You could be having a normal day, reading the newspaper, watching TV, eating lunch, and suddenly your words don't come out the way you intended. Or your smile becomes uneven. These subtle changes may feel strange but not scary, and that's what makes them dangerous. Because when it comes to a stroke, the sooner you get treatment, the greater your chance of recovery. Take Robert, a 68-year-old Vietnam veteran. One morning while having coffee, he dropped the cup from his right hand and couldn't understand why. He called out to his wife, but his words didn't sound right. She took one look at his face, saw that his smile was crooked, and called 911. Robert received treatment within an hour and made a remarkable recovery. "If she hadn't acted fast, I might be in a wheelchair, or worse," he shared later. The medical community uses the acronym FAST, face, arms, speech, time, to teach people how to recognize a stroke. But the part most people forget is the last letter T for time. That means every minute counts. If there's slurred speech, facial asymmetry, or sudden weakness, don't take a nap, don't wait for a doctor's appointment. Call emergency services and get help. Because when your brain is in trouble, acting fast could save your ability to walk, talk, remember, and live independently. Sign 2, sudden chest tightness or pain. One of the most urgent signs your body can give is a sudden, unexplained pain or pressure in your chest. It might feel like a tightness, a squeezing, or even a burning sensation, and it can spread to your arms, shoulders, neck, or jaw. While some people try to convince themselves it's just heartburn or anxiety, the reality is this could be your heart crying out for help. And in older adults, this is especially dangerous because the signs of a heart attack can be subtle, slow, or completely unlike what you'd expect. A cardiologist once shared the number of patients who arrived too late. Because they thought it was indigestion, it's heartbreaking. If there's even a chance it's cardiac, get checked. That statement holds a lot of truth, especially when you consider that many heart attacks in seniors don't come with the crushing pain we see on television. Sometimes it's a dull ache, a fluttering feeling, or just a sense that something isn't quite right. You may feel dizzy, short of breath, or suddenly exhausted, even without physical activity. These aren't things to monitor, they're things to act on. Take Helen, a 74-year-old retired school teacher. One afternoon, she felt a strange tightness in her chest while reading a book. It wasn't excruciating, but it lingered. "I thought maybe it was gas," she said, "but something told me to call my daughter." Her daughter rushed over and insisted they go to the hospital. Helen had suffered a mild heart attack. Thankfully, she was treated quickly and made a full recovery. "If I had waited, I might not be here," she said. "Now I listened to my body the first time." That's the lesson here. When your body is in distress, it doesn't always scream, it often whispers. And with something as serious as heart trouble, those whispers can be a final warning. Don't wait until you're on the floor or can't breathe. If you experience chest discomfort that's unfamiliar, persistent, or accompanied by other symptoms, go. Don't wonder. Don't wait. Just go. If you're still watching this video, and finding these insights valuable? Please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 3, shortness of breath without exertion. There's a difference between catching your breath after climbing stairs and feeling like you can't breathe while you're sitting still. If you find yourself gasping for air during a quiet moment, reading on the couch, watching TV, or even lying in bed, it's not something to brush off. Sudden shortness of breath without any real physical activity can be a red flag for serious conditions like heart failure, pneumonia, or even a pulmonary embolism, which is a blood clot in the lungs. All of these require urgent medical attention. A respiratory specialist once said, "If breathing becomes difficult for no clear reason, that's your body raising an alarm. It's not just age or fatigue, it's a cry for help." That statement rings especially true for older adults. As we age, our lung capacity naturally decreases and our heart works harder to pump oxygen-rich blood throughout the body. But what separates a normal sign of aging from a medical emergency is how suddenly it appears and how severe it becomes. If you're breathing hard after simply walking across the room, or if you wake up feeling like you can't catch your breath, something is wrong. It might be your lungs, your heart, or both, and waiting could mean worsening symptoms or irreversible damage. Let's take the example of Walter, a 76-year-old retired electrician. He'd always been in decent shape, but one evening while watching his favorite show, he felt like he couldn't get enough air. There was no chest pain, no fever, no activity, just this overwhelming sense of breathlessness. His daughter convinced him to go to the hospital, where they found a small blood clot in his lung. "If I had waited until morning," Walter said, "I might not have woken up." That's the lesson to take away. Shortness of breath isn't something to monitor later. It's something to act on now, especially when it comes on suddenly or worsens quickly or makes even simple tasks feel like a workout. Trust your body. It knows when something is off, even if you're not quite sure what it is yet. If breathing becomes difficult for no obvious reason, go straight to the emergency room. It's better to find out. It was nothing than to find out too late. It was everything. Sign 4, unusual confusion or sudden disorientation. When a senior becomes suddenly confused, forgets familiar things, or appears disoriented about where they are, or what time it is, it's easy to blame it on getting older. But that kind of mental fog that appears quickly, especially if it's out of character, is one of the most serious warning signs there is. It could point to a stroke, a brain infection, dangerously low oxygen levels, or even a severe reaction to medication. And every one of those possibilities requires immediate medical attention. A hospitalist once shared, in older adults, the brain is often the first organ to signal trouble. Sudden confusion is the body's emergency light flashing. That observation is especially important because many seniors and their families may not recognize confusion as an emergency. They might think it's just tiredness or a bad day, but when the change is sudden, like forgetting names, getting lost in familiar places, or speaking in ways that don't make sense, it's time to take it seriously. These aren't gradual memory changes. They're abrupt shifts that often signal something much deeper. Take Linda, an 80-year-old woman who lived independently and managed her own affairs. One morning, her neighbor found her standing in the hallway of their building, unsure of how she got there or why. She was fully dressed, but seemed startled and kept repeating the same question. Her family thought maybe it was dehydration or fatigue, but when they brought her to the hospital, she was diagnosed with a urinary tract infection that had triggered a sudden onset of delirium. She received antibiotics and fluids and returned to her normal self within a few days. "I didn't know confusion could come from something like that," her daughter said. "Now I'll never ignore it." That's exactly the kind of outcome we hope for. The brain is sensitive, and in seniors, it often responds to other problems like infection, lack of oxygen, or even blood sugar changes before anything else does. So when confusion strikes out of the blue, don't wait for it to clear up on its own. It might, but if it doesn't, or if it worsens, the consequences can be irreversible. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 5, severe or sudden abdominal pain. We all experience aches and pains from time to time, especially as we get older. But when that pain is sharp, sudden, or feels like it's getting worse by the minute, especially in the abdominal area, It's not something to ignore or wait out. Severe belly pain can signal a medical emergency such as appendicitis, a perforated ulcer, pancreatitis, or even internal bleeding. In older adults, abdominal pain can also point to a blocked intestine or a ruptured organ, both of which can be life-threatening if not treated right away. A trauma surgeon once explained, "When a senior complains of sudden abdominal pain, we take it very seriously because time makes all the difference between a fixable problem and a fatal one." That perspective should stick with you, because for seniors, the risk of complications is higher, and the classic signs of illness don't always appear the same way. You might not even have a fever or visible swelling. You might just feel off, or you might double over in pain without warning. Either way, your body is telling you something, and you need to respond. Let me tell you about Frank, a 72-year-old widower who prided himself on being tough. One evening while finishing dinner, he felt a stabbing pain in his lower abdomen. He assumed it was gas, took some antacids, and went to bed. By morning, the pain had spread, and he was too weak to stand. His daughter called an ambulance, and the ER team found a twisted section of his intestine that had cut off blood flow. Emergency surgery saved his life. "I thought it would pass," Frank later said. "I didn't realize how fast things can go downhill." That story isn't uncommon. Seniors often downplay pain or wait to see if it improves. But when the pain is sharp, persistent, or unlike anything you felt before, it's not the time to tough it out. It's time to go in. You won't lose anything by being cautious, but you could lose everything by waiting too long. If you feel intense abdominal discomfort that doesn't go away, especially if it's accompanied by nausea, vomiting, or dizziness, don't guess. Don't Google. Go. Sign 6, persistent vomiting or vomiting blood. Throwing up once in a while, maybe from spoiled food or a stomach bug, is unpleasant but usually passes. But when vomiting continues for hours, or if there's blood mixed in, it stops being a simple nuisance and becomes a serious medical concern. Persistent vomiting can lead to severe dehydration, electrolyte imbalance, and even kidney issues. And vomiting blood, no matter how small the amount, may point to something much more dangerous, like bleeding in your stomach, a torn esophagus, or ulcers that have ruptured. A gastrointestinal specialist once said, "Blood in vomit is never normal. It's one of the fastest ways we identify internal bleeding in older adults." That should stop anyone in their tracks, especially because some people shrug it off or misidentify it. The blood may appear bright red, or it may look like coffee grounds, dark, grainy, and unexpected. Either way, it's a sign that something is going wrong inside your digestive tract. For seniors, this can be a reaction to medications like anti-inflammatories, a complication of an undiagnosed condition, or even stress-related damage to the stomach lining. Consider Evelyn, a 79-year-old woman who had been taking over-the-counter pain relievers for her arthritis. One night, she started vomiting after dinner. At first, she blamed the shrimp, but when she saw dark flecks in the sink, what she thought was old food, her grandson insisted on calling for help. At the hospital, doctors confirmed she had a bleeding ulcer that had been quietly growing for months. "I had no idea it was that serious," she admitted. "But if I hadn't gone in, I might not have lasted another day." This is a warning that can't be overstated. Vomiting blood is not something that waits until morning. It's not something to sleep off or to fix with ginger ale. It means something in your body's broken and it's leaking into places it shouldn't. Whether it's a damaged stomach, liver complications, or a burst blood vessel, only immediate medical care can determine the source and stop it in time. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 7, high fever with stiff neck and sensitivity to light. When you have a fever, it's usually a sign that your body is fighting something off. But if that fever is high and comes with a stiff neck, headaches, confusion, or trouble with bright lights, it may be a sign of meningitis, a life-threatening inflammation of the protective layers around your brain and spinal cord. While meningitis is more common in younger people, it can absolutely affect older adults, especially those with weakened immune systems or other ongoing health issues. And when it does, it can move fast, too fast to ignore. An emergency physician once said, "If an older adult comes in with fever and can't bend their neck or handle the light, we drop everything." That's how urgent it is. That kind of urgency speaks volumes, because by the time these symptoms appear, the infection may already be in full swing. The stiffness in the neck isn't just discomfort. It's your body telling you that the lining around your brain is inflamed. And the light sensitivity isn't just annoying, it's a signal that your central nervous system is under attack. For some, it also comes with nausea, vomiting, or a feeling like your head is going to explode from pressure. And none of this should ever be dismissed as just a bug. Take Jerry, a 75-year-old widower and avid crossword puzzler. One morning, he couldn't finish his daily puzzle because of a pounding headache. By afternoon, his neck hurt so much he couldn't look down, and the light from his kitchen window felt unbearable. Thankfully, his neighbor, a retired nurse, recognized the signs and drove him straight to the hospital. Doctors confirmed bacterial meningitis, and thanks to fast intervention, Jerry survived. "I thought I was just run down," he later said. "I had no idea it could be something so serious." That's the reality. When your body sends out warning flares like this, fever, stiff neck, light sensitivity, it's not overreacting, and neither should you. These signs suggest something is attacking your nervous system. And with meningitis, every hour counts. Treatment is available, and it works best when it's started early. So don't hesitate. If you or someone you love shows these symptoms, don't wait for an appointment or try to sleep it off. Go to the emergency room and let the professionals take it from there. You'll never regret playing it safe with your health, but waiting might be a risk you can't afford to take. Final thoughts. By now, you've seen just how important it is to listen to the signals your body sends, and especially as we get older. These 7 signs aren't meant to frighten you. They're meant to empower you. Because knowing when to take action isn't weakness, it's wisdom. And wisdom, especially the kind that comes from years of living, means understanding that your health deserves urgency, not delay. It's easy to brush things off, to say I'll be fine, or it's probably nothing. But in many of the stories we shared today, people were only saved because they chose to act, because someone recognized the sign, picked up the phone, or drove to the hospital. Those moments made all the difference. And remember, taking care of yourself isn't just for you. It's for your family, your friends, the people who care about you and need you around. Every day you stay safe and strong is a day they get to enjoy your wisdom, your stories, and your love. So treat your health like the precious gift it is. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.